Good Friday morning, everyone. It is January 14th. Welcome to the Morning Medical Update. Thank you so much for joining us here on Facebook and on YouTube. A busy weekend ahead in the Metro, and we have an equally busy show for you this morning. First, we're going to update you on our COVID patient count. Amanda Cackler, she is the Director of Infection Prevention and Control. She's going to break down our COVID deaths. Then Dr. Amber Schmidtke, Chair of the Division of Natural Sciences and Mathematics at the University of St. Mary. She's going to give us the big picture with nationwide numbers, and she's going to offer a COVID forecast. Also, glad to have Dr. Tim Williamson, pulmonologist, critical care specialist, and VP of Quality and Safety at the health system, with updates on the current crisis with regional and state hospitals. Also, it is Restaurant Week. It is beginning today, so Bill Teal, Executive Director of the Kansas City Area Restaurant Association, he is going to explain how COVID is impacting that annual event. Plus, as we all know, it is playoff weekend for the Chiefs, and what effect will 80,000 fans from here and Pittsburgh packed into the stadium have on the COVID surge? We're going to be answering your questions. We're going to take some questions from reporters here in a bit, so make sure you get yours sent in to YouTube and Facebook, and right there you can email them to the Medical News Network. But first, you may be waking up to hear that more schools have canceled classes today because of COVID. Students in the DeSoto, Eudora, and Knob Noster school districts have the day off because of a large number of teachers out with the virus. Nearly 20% of classroom teachers are out. Classroom does resume on Tuesday, but on Wednesday, the Bonner Springs School District also closed for the rest of the week due to a high amount of absences there. And the Olathe Herald reports that Olathe School Superintendent Brett Yeager also says that the district is close to having to close schools with hundreds of employees out there. So we have lots to get to today. And on that note, I want to get to our COVID count today with Dr. Dana Hawkinson. It seems like we see these types of things happening out in our community and schools, and it's kind of marrying up with what we are seeing in the hospital. What can you tell us?
Yeah, and I don't know if this is just a function of Amanda being on the show who generates these daily counts for us, or if it's just bad luck of Dr. Tim Williamson here. But unfortunately, our numbers have gone up for active patients. 129 active infections right now, 29 in the ICU. And as you can see, we've had a large proportion who are on the ventilator. We continue to have those ventilator needs for a large proportion of those ICU patients. 50 in the recovery period as well, so a total of 179. Should mention also within the last 24 hours, we have had 3 deaths, unfortunately.
All right, Dr. Hawkinson, thanks. We're going to get back with you here in just a moment. But Amanda Cackler, I want to start with you and help us kind of break down when we talk about the COVID count. When Dr. Hawkinson shares that a patient has died overnight, a lot of people want to know what brought that on, and what can you tell us when we receive these numbers and we see them put up on the screen every day? What does that all mean?
Yeah, so it's something that we are monitoring very, very closely, and most often these are folks that have come to the organization or to the hospital with a COVID, like that's what they're seeking treatment for. A lot of it has to do with their increasing needs for respiratory support. And unfortunately, as Dr. Hawkinson alluded to, we had 3 just yesterday, and the majority of our patients who are dying in the hospital are unvaccinated. So just to give some perspective on that, we've already had 21 deaths to date in January, and almost 85% of them were unvaccinated.
So what else can you tell us about, because people want to know who is most at risk? Let's just talk about that a little bit. So we talk about, we've been talking about comorbidities and things of that nature, but let's just talk about that real quick.
Yeah, so I dug into the details yesterday on the patients, and it was in the middle of the day, so it's not exactly the 129 that we're reporting this morning, but it was about 117 inpatients yesterday who were here who also had a COVID positive test. So we do know that there are some patients who come to the hospital, specifically in our behavioral health setting or in our maternal child setting, who they're coming here because they're going to deliver a baby or they're here for other needs, and they just are incidentally found to be COVID positive. Although the majority, and there's for sure, yesterday when I was looking at it, there were 53% who were here. Their principal diagnosis was COVID-19, so they were actively being treated for the COVID-19. And then there's a portion where it's really hard for me to tell, just looking briefly at the H&P or their history and physical. Are they here because of COVID, or are they here because of a condition that might have been impacted by their COVID diagnosis? So those are ones that I kind of I can't say, is it COVID or is it not? But when you ask who's most at risk, I think our experience here and what we know from across the country are those who are unvaccinated are those who are highest risk for needing treatment within the hospital for their COVID disease.
This is the second or third time that we have reported deaths on the show. Just what is concerning you right now? You put this report out every single morning before it makes it to our show. When you get that in the morning, you're putting that together and getting it out to us. What are you noticing? What trends are you seeing? And what is really concerning you?
I think it's still that unvaccinated population. I mean, obviously, as we're seeing more and more COVID cases, we're going to see more and more deaths associated to COVID. We've seen kind of ebbs and flows within our COVID deaths, but we also see that kind of follow the overall positivity in the community.
All right, hang tight. We're going to have questions for you coming up in just a bit. I want to turn to Dr. Amber Schmidtke. First, I just want to let you know, I let folks know your household has been hit by COVID right now. How are you all managing at the house right now?
Yeah, so I'm talking to you from my office right now at work, but my son is home because he was diagnosed with COVID on Monday. He was fully vaccinated. That was true right around the time of Thanksgiving. But unfortunately, he's too young to be boosted. And so he is home sick. His symptoms are mild. It's a sore throat, some coughing and congestion. He's never had a fever throughout all of this. But of course, we're monitoring things very closely. But thank you very much for your concern. We're just trying to isolate him to the extent that we can. But he's 10 years old, so, it's a little bit of a struggle.
Hard to do, and you're a mama, so it's hard to stay away from the kiddos. And I'm just sorry to hear that, because every time you come on the show, you always talk about you're so diligent about, you've taken COVID so seriously. I mean, you've set the bar because you canceled trips to make sure everybody was vaccinated and safe. So it just goes to show even people who are doing it right are being hit by this right now. So thanks for sharing that, and please keep you and your family safe. Just some slight good news though, Dr. Schmidtke. We were talking a little bit yesterday, reports along the East Coast showing a slowing down of Omicron cases. What might that tell us here in the Midwest? Any good news for us?
I don't think we're quite there yet. I did bring some data with me, so if the gentleman in the booth could bring that up for me, I'll walk through it with you, and then at the end, we'll talk about what this might mean for the Midwest. So what we're looking at here is testing data for the United States. And if you're one of those folks that's been struggling to get a test, me too, you are not alone. And what we're seeing here on the map is what is test positivity looking like across every county in the United States. The darker red you are, the higher the test positivity. And what we use test positivity for is as a sort of indicator as to whether our case rates are an accurate count. When test positivity is high, it's more likely that we are undercounting cases. And right now, test positivity, including in Kansas and Missouri, is sky high. So if you look down at the bottom left, you're looking at how does PCR test positivity compare across the age groups for Kansas and Missouri. And that dashed gray line is the goal line where we want to be. So you can see that we are really, really high. If we look at a national level, what you can see is this is age group breakdown once again on a national level. And what we're seeing here is that things are leveling off. So as hard as it has been to get a test, what this is telling us is that we are starting to be able to cope with the demand for testing with respect to how many cases are out there. So that's good news in a way. So we'll move to the next slide and talk a little bit about case rate. So you'll notice that the map doesn't look all that different with respect to test positivity versus cases. It's just blowing up everywhere. And one thing I'll point out, you'll see that big green Tennessee right there. They just started changing their reporting from daily to weekly, so don't lose any focus on that. Just sort of ignore that for the moment. But case rate is really high. And if we look regionally, we had this disconnect for a time where case rate was rising for the Midwest and the Northeast, but we saw this disconnect on hospitalizations. I'll show you in a second that that's no longer the case. But right now, case rate is rising very, very fast, dwarfing anything that we've ever seen before. And that's true across all regions, but it's highest in the Northeast. And on the upper right, I brought to you what our vaccination rate looks like for different age groups and for the total population. The U.S. average is there on the bottom. For certain things, we're right on par, right? For the percent of our population that is fully vaccinated and boosted, we are right there with the national average on both sides of the river. But we're below average for some other things when it comes to kids being fully vaccinated, when it comes to percent of the total population being fully vaccinated. So we're not as well protected as we might think we are. So we'll move to the next slide and talk a little bit about hospitalizations. So for this, what I wanted to point out in the peach-colored graph on the upper right is that hospital admissions are higher than they have ever been. And right now, because this is a nationwide problem, even if things start to get better on the East Coast, we're still, dealing with this everywhere. And so I don't expect the national numbers to start trending down anytime soon, unfortunately. If we look at the bottom right, what you're looking at is that same kind of information, but broken down by region. And so this is where I was trying to point out that earlier, that purple line is the Midwest and the blue line is the Northeast. And we used to see that hospitalization rates were much higher for the Midwest than for the Northeast, but that's no longer the case. And part of that is because of, the thought that Omicron has better ability to evade some of the immunity that we may have on board, which is why it's so important to get boosted. And then the last thing I'll point out on this slide is something that I track really closely for the state of Georgia on the bottom left, and that is how many staffed ICU beds remain in the state. Just in case you didn't know, Georgia has a population of 10.6 million people. During the Delta wave of August and September of the past year, at one point they ran out down to 62 beds for that population. And what you can see is the trend line is pointing down once again. They are starting to lose beds very fast because of a combination of hospital demand for patients and also staff shortages because people are out sick, they're not able to cover as many shifts as they used to, that sort of thing. Now, let's talk about what we would want to look for in terms of when is this peak coming to, or when is this surge coming to a peak? So let's move to the next slide, please. We have wastewater surveillance data for the state of Missouri. So what's going on here is every wastewater outlet, they're able to test for the presence of virus. And so they're measuring it throughout the state. On the map on the left, what you're looking at, if you see a red triangle, that means that the presence of virus is increasing. If it is an orange circle, that means it's leveled off. If it's a green triangle, that means that virus presence is going down. What you'll notice for Kansas City is it's mostly red triangles, right? There are 9 water outlets for the state of Missouri, or for the city of Kansas City on the Missouri side, and only one of them right now is showing signs of leveling off. On the right, what you can see is one of those regions and what viral load looks like in that space. And you can see it's continuing to rise, and it's higher than it's been in a very, very long time. So this is something we're going to want to pay attention to, because usually these trends predate what we see with cases by about a week. So the fact that we are not yet seeing, the majority of the Kansas City wastewater treatment starting to level off is a sign that we're not quite out of the woods yet. And so I want to be hopeful, of course. I want this to be over as much as anybody else, but we are not quite there yet. And so I'll kick it back over to you, Jessica.
I figured you were going to say that. Not quite the news we wanted to hear, but thanks for the facts. Question then, we hear a lot of times that Omicron and the symptoms are described as mild. That concerns you. Why?
Well, the thing about a mild illness is that it's a numbers thing, right? So, we can say that X% of cases result in hospitalization, but what we're talking about here is numerators and denominators. I'm making everybody twitch with talk of math, right? But the reality is the more people who are sick, the more that numerator becomes a bigger number. And that's why we're seeing that burden in the hospital, like Dr. Hawkinson talks to us about all the time. And so even with a mild illness, what's happening here is that people may brush that off. They may think it's allergies, or they may think it's something else, and they may go to work anyway. And they may be inadvertently spreading disease to others with mild symptoms. And unfortunately, this virus is one of those that's going to find those who are most vulnerable. It's certainly going to find those who are unvaccinated or unboosted. And so that's something that we want to be real careful about.
All right, Dr. Schmidtke, stay close by. We'll be back with you in just a moment. Dr. Tim Williamson, glad you're here today. He's a pulmonologist and critical care specialist and VP of Quality and Safety here at the health system. Lots of big titles, lots of good information for us today. I first want to touch on yesterday's news that the Supreme Court ruled to uphold the CMS vaccine mandate. Tell us what that impact will be.
Yeah, I think that was good news, and we're happy to hear that. So CMS had several months ago mandated that any healthcare institution that received Medicare or Medicaid funds would need to have policies in place and procedures in place so that all of their employees and providers were vaccinated with some opportunities for exemptions. There was some legal challenges to that, and that was there was an injunction in about half of the states And basically the Supreme Court ruling stays that injunction, allows the CMS mandate to move forward while it's being further discussed in the courts. So we think that's really important. We've had a requirement here since September 1st is when we announced it, because we think it's the right thing to do for our employees, providers, and patients, and to keep everybody safe.
Amanda, your response to that?
Oh, I was just completely agreeing with what he was saying, and the need for us to have that here to keep everyone safe.
All right, Dr. Williamson, you know, our chief medical officers across the state met last week to discuss the crisis that's happening in the hospital system across the state. Where do we stand today?
Yeah, so we've had lots of conversations with our chief medical officers, and it's been a rough couple of weeks, and you've heard directly from them about some of that, and that's not changed. We've seen, we had great data presented, and that has really, we've seen the impact on very real people over the past couple of weeks. So hospitalizations across the region continue to go up. Other types of illnesses and injuries don't go away, and they continue to need care. We've had really rough staffing crises because of folks out being sick or being tested. Our own staffing is getting a little bit better. We had roughly 950 out for testing or isolation, I think last week. We're down into the 500s, but that's still a big impact to staffing. And so high hospitalizations, we've seen other resources that haven't typically been impacted to date be impacted, such as we've had a couple of even larger hospitals struggle with ventilator capacity. Other meds like monoclonal antibodies have been on short supply. And kids, we've seen record high number of kids being hospitalized. So that is unfortunate as well. We've made a lot of changes, as have other hospitals. We're using lots of folks that have clinical backgrounds but not in clinical roles. We've reassigned them so that they are able to help provide direct patient care. And across the metro area, there's been big impacts on transfers. It's been difficult for us and other hospitals to get those sick people who need to be at a larger hospital in. I think in December we were only able to take about 17% of the 2,000 requests that we had. And then there's impact on surgeries. We've had a number, pretty much virtually all hospitals in the metro area have had to postpone or defer surgeries, a large number of those surgeries over the past couple of weeks, and likely will continue for the coming week or two. I think lastly, I would say, just remind, and I know we've said it so many times on this show, you saw that we've not probably quite yet peaked on cases, and we know hospitalizations trail the cases by a couple of 3 weeks, and we're seeing that in the both national, state, regional numbers, that those numbers continue to go up. So we're going to continue to see the strain on the healthcare system. I think we're all very worried about where do those hospitalizations peak and when, and what are the impact of some of the variables we'll talk a little bit about later, but whether that be any large sporting events or concerts or large gatherings of any type. Many of the colleges come back into session actually this weekend, and so that, we have more folks in congregate settings that could spread. So we have a lot of things that could further make this even more challenging as we get more people together, particularly if those people are not vaccinated or not masked. And we know there are some systems that are coming back, some colleges coming back with masks, and we know that there's some coming back without masks. And of course that makes us very concerned as well.
So with everything that you have said and with where you stand, what is and during the surge, what is the biggest burden you think right now, the biggest challenge with what we're seeing at this phase in the pandemic when it comes to hospitals?
I think it's that balance of supply and demand. And so we have ever increasing numbers of patients who are going to need our care. We've had struggles with staff as a resource in terms of staff being out. And then resilience of those staff. They're tired, and this has been a long, hard pandemic. And knowing that there's still potentially harder times to come, I really, really worry about all of our employees and providers who are taking care of patients and the toll on them. Not to mention, Amanda really has highlighted, the number of deaths we've had. we, as the number of cases go up, the number of deaths are going to go up, and it's heartbreaking because those largely, not entirely, but largely are preventable. And once you're sick with COVID, once you're here, once you're in the ICU, once you're on a ventilator, it's too late to get vaccinated. And we see people ask for that all the time.
I was going to ask, somebody asked me the other day, if somebody comes in with COVID, has a change of heart and wants to get the vaccine, they can't get it right away. They have to wait until hopefully they get out of the hospital.
Right. They would have to wait till they get out of the hospital and recovered a bit, and there's some guidelines around that. But the other thing, it's too late to be effective. Once you have COVID, it's not going to do anything.
It's not going to save you.
Right. It won't.
All right.
And can I just add one
Yes.
little thing here? Because I know we started off with the school closures, and the impact that will have additionally on our staffing could be extremely detrimental. And so I think that's something that's very concerning to me right now, is the number of employees that we have here with school-age children. And what does that mean if they go to a virtual setting, even though it might be in the best interest of the public health?
Because when we have so many staff out, a question is, what, do they all have COVID? I'm like, no, they all have children. Yeah. They all have other things going on in
That's
their
right.
lives that
That's
are
right.
keeping them home.
Well, and those numbers we share really are the folks out who are sick or testing, but it doesn't capture those who are out because their kids are sick or school is closed.
So they're isolating.
And it's a community issue. It's not just our issue. It's police, fire, EMS, schools,
Right.
Nursing homes.
name it.
It's everywhere in terms of trying to keep our communities functioning.
All right, so another industry impacted are restaurants, small businesses. We know that. So we're going to bring in Bill Teal now. He is joining us. He's Executive Director of the Kansas City Area Restaurant Association. We're so glad you're here. We are kicking off Restaurant Week, Bill. That's usually such a great time for this foodie city that we live in. Kansas Cityans love their restaurants and they love to support small businesses. But what challenges are they facing right now?
It's interesting. We're talking about staffing shortages here. And that's exactly what's affecting restaurants. Consumer demand remains strong, but we kind of starting around New Year's Eve, some restaurants were experiencing outbreaks. So we had a couple restaurants that had to close because of staffing shortages. And that seems to be happening still as we enter Restaurant Week. So we're a little bit worried about some restaurants' cases, whether they can stay open during Restaurant Week. Hopefully that's not a problem, but being able to serve customers, not just because of cases, but if you have a case in a restaurant, then you have people that have to isolate who've been in close contact. So it kind of, it affects your whole operation. And unfortunately, some restaurants have had to close for short periods of time. It seems like when they close, it may be for 5 days to 10 days is kind of the time frame for the virus to kind of work its way through and get settled out. But that's our biggest concern we have for Restaurant Week.
And it's heartbreaking anytime we see, a local restaurant or business have to close their doors. We know that what that means, that people aren't making money and people aren't working. So we know that is tough. And Bill, I got to say, we have this new appreciation for restaurants and our ability to go out and eat and that freedom to be able to safely go and enjoy, visiting with our friends and family and doing all of that. So just a new appreciation for all restaurant owners. But what are restaurants doing now and certainly during Restaurant Week, but trying to keep their patrons safe and, of course, trying to keep their people safe?
Well, restaurants have been dealing with this now for 2 years, so they've gotten pretty good with increased safety measures. We have a lot of the staff still wear masks. Sanitation, the restaurants have stepped up their sanitation procedures and safety procedures. You'll see a lot more plexiglass still in restaurants to try to separate patrons as much as possible. At one time, we had decreased occupancy, so restaurants had to spread tables out to separate customers more. And a lot of restaurants have still kind of kept that distance between tables, so that helps. And there's just an overall concern that remains for the safety of patrons just as much as possible within restaurants, understanding it's always going to be a little difficult because of the nature of restaurants, and you have a lot of people, in a fairly tight space. As it relates to Restaurant Week, a lot of restaurants are doing carry out and delivery. So if you're not comfortable as a customer to come in and spend time in the restaurant, then of course we encourage you to take advantage of the carryout and delivery components of Restaurant Week.
Well, we sure will. That was kind of my next question. Just what can all of us do to help keep these businesses open and still participate and still enjoy great food here in the city? What can we do? Any advice for folks who want to help support businesses, but also keep themselves and their families safe?
Well, the big thing is take advantage of delivery and carry out. And, a lot of our restaurants, there are 3,000 eating and drinking establishments in the greater Kansas City restaurants. So that's a lot of small businesses. And a lot of them are, just small little privately owned operations. So anything you can do to support them, again, with the carry out or delivery is a big help, because they have been through a lot, just like all of us, over the last 2 years. And a lot of them are still fighting to survive and stay open.
Bill, has the restaurant industry made a comeback? I mean, where do they stand today? Have they been able to bounce back? I know they're doing it right. They've been doing it for the last couple of years, but where do they go from here?
It's interesting. Restaurateurs are a very resilient group. And I saw some information last week that showed, I think it's 50 some restaurants scheduled to open in the first half of 2022 in Kansas City. So unfortunately, we lose restaurants, but there are always restaurateurs willing to get back up off the deck and open a new operation. So it's going to be tough. It has been tough, but restaurateurs will survive. And I think the restaurant scene will stay strong in Kansas City. Hopefully we can get all this behind us and get back to doing what we all do best.
Well, we are here to support you. We've got some of the best restaurants in the country. There's no doubt. So we want to do whatever we can to help the employees and the businesses stay open, and hopefully see new ones coming in 2022. So, Bill, thank you so much for that update. Stick around. We may have some questions for you from our audience today. But Dr. Hawkinson, you're up. We're talking sports a little bit, because we know the Kansas Cityans are going to be watching the game, either watching it, the playoffs from home, in the stands, or possibly in a bar. Let's just jump in. Can you offer up some advice?
Yeah, I mean, I think the first advice is to be fully vaccinated and boosted, as we heard Dr. Schmidtke talk about. So fully vaccinated, and then 5 or 6 months later, depending on what your criteria is, getting that additional dose or that booster dose. That's the first thing. The second thing is, if you can remain outdoors. We know there are some indoor areas, at Arrowhead. But being outdoors, we've always really promoted that as being safe. Now, certainly one other thing you can do as an individual is wear your mask. That's always an appropriate thing to do. But, being in those outdoor situations, or if you are kind of going on the concourse or whatever, wearing your mask at that point too, if you really feel the need to not want to wear a mask outdoors. That is extremely important. As far as people who aren't going to the game, I would say right now it is extremely important to try and not to have those gatherings or meet with that bubble that or those people that are fully vaccinated. I think that's just important. We all do better when we all do better, and we certainly want our places of businesses and our bars and everybody employed by there to be able to work and stay in business. I think that is important, but right now it is extremely dangerous to have either private or public gatherings for those things. But the first thing you can do, again, is be vaccinated, be fully vaccinated plus that booster. Or if you can hold outdoor gatherings to watch the game. I know it will be it'll be a little cold, but I think it can be done. There are plenty of heaters now that are available for purchase and things like that. So that would be my biggest recommendation.
And don't you think it's fair to ask people who come over to your house if they're vaccinated? If they're not, they're just going to have to hold off till the next playoffs, right?
Absolutely. And I think if they're having symptoms, they should probably stay home. It certainly could be another cough or cold. It could be influenza. But we've always touted that as well. If you're ill, you probably should not be going to those places and doing those kinds of interpersonal interactions as well.
What about all those Steelers fans coming in from Pittsburgh? When we have other people coming in over into our...
They should stay in Pittsburgh.
They should stay in Pittsburgh. They're going to be going back to Pittsburgh. Really sad, we hope. Okay, but while they're here, they're going to be out with our people. They're going to be out at our restaurants. And then our people are going to go back to their families and their jobs. So what impact do you think that might have?
It certainly could have an impact. I would expect that most of the people who are coming from Pittsburgh are actually going to the game or maybe going to a relative's house or something like that. I think the vast majority, if you're going to go to another city to see your team, you are probably actually going to that venue. And again, being outdoors is good. It's always good to come in and help the economy and spend the money and see the sights and go to the restaurants and help our businesses in that way. But again, be thoughtful about doing that. Continue to wear the mask in those indoor settings. And again, I hope a lot of these people who are coming in are vaccinated. We have to assume probably many of them are not. But those are things that you can do, is continue to do those pillars of infection prevention. Understand the circumstances, the area that you're going into, that environment. Wear your mask, socially distance if possible. If you can be outdoors, that's great. We know Pittsburgh has very cold weather, so this is probably not too bad for them. But doing things outdoors or in well-ventilated space is important, and continuing hand hygiene as well.
Yeah, Amanda.
I think the map that we saw earlier, I don't know that there's any place in the United States right now that is.
Yeah.
It was red hot.
It's right. We've got COVID everywhere, so having them come in here is probably not too much different than what's
where they
going on
are
in Pittsburgh.
now.
Mm-hmm.
Dr. Schmidtke, what can you add when you look at state to state? Does that have an impact, or maybe it would in the past, but does it have an impact now?
Yeah, I mean, you mentioned when you asked the question, do we think that they're going to be bringing in a new variant? And most likely not, like Dr. Hawkinson said, because right now almost every region in the U.S. has Omicron as the dominant variant. So it's really just more mixing of that. But without a doubt, we've seen the impact of travel and the impact of people gathering, especially for large events. When we had Sturgis that really kind of kicked off the summer 2020 wave, that led to, an out and down sort of pattern across the United States. It wasn't the event itself. The Chiefs game itself will not usually be an issue. It's usually the tangential things that happen where people gather afterwards at the bar or they do whatever. And I know we're supporting our bars and restaurants as much as we can, but you want to try to do that as responsibly as you can. Take advantage of the outdoor dining if it's available. Wear your masks when you can, that sort of thing.
Yeah, Bill, I'm sure you certainly welcome people from all over to come into our city and eat at our restaurants. You just want to make sure they're doing it safe, right?
Oh, absolutely. And I think restaurants have tried as best as possible to focus on safety. It's always a concern. The restaurants can do their best, but you've got people coming in from the outside that you can't necessarily control. So again, good points. Wear your mask, social distance if possible. Of course, everybody get the vaccination and the booster.
Yeah, can't say it enough. All right, let's get to some reporter questions. Any on the line today? Because I know we got some from our community. Nada? All right, I'm just going to move on to our community because they've always got good questions for us. And let's just start with Michael. Of all the hospitalizations, of those who are hospitalized because of COVID, how many were previously infected? Again, this comes back to the power of natural immunity. Mm-hmm.
Yeah, I don't have
that.
I don't have that information available today. It's probably something that we could dig into a little bit further, but something to keep in mind is that these are things that if those are questions we're looking into, a lot of it requires some manual digging into, and when we've got a volume of 129, it's hard to go through and identify that. But we do have teams that are working on building out those reports, but today I can't provide that information.
Yeah, I think that's real hard, Amanda. I think you're exactly right. You can probably look at it at a population level. I think you'd have to do a lot of investigation, and we have so many other things going on right now. You'd have to do a lot of investigation at that individual patient and hospital level to be able to do that. But from what we know from the early South African data is if you tease through and get granular in the data and really understand those dynamics and those details, is that a lot of those patients were previously infected with Delta or something else, and so that aids to helping reduce some of that. But I think it is difficult to tell for patients exactly were they infected before. With just so many patients. If you have 3 or 4 or 5 patients in the hospital, obviously that's easy to track that down, but with 100 and some, it's very difficult.
Yeah, that makes sense. Arietta is curious, if you're overweight and diabetic, but vaccinated and boosted, are you safe?
So you probably are going to have a bigger look at this, but I do know when I was looking at the patients who are in-house today, who are also vaccinated, but who are also here with a COVID infection, those comorbidities do play a role. And I saw a lot yesterday when looking at it that there were a lot of folks here with significant cancer, recent transplant, acute kidney injury, diabetes, morbid obesity. Those were all comorbidities that I saw in our current patient population. And I think that is fairly consistent with what I've seen and heard Dr. Hawkinson talk through.
Yeah, I would completely agree. So it is a spectrum and a continuum. It is not one thing, black or white. It is taking all those details and kind of assessing those risk factors. Now, certainly the best thing that you're going to be doing to protect yourself is, again, trying to avoid the virus. The next is obviously vaccination, being fully boosted, fully vaccinated, and then having that third dose or that booster dose is extremely important. And then there will play a role of those other comorbidities. And certainly what we have seen, and we heard Dr. Brown talk about this yesterday at the end of the show, describing that paper, that MMWR paper that showed, certainly the more comorbidities you have, the more chronic health conditions you have, that does place you at greater risk as well. So it's not an all or nothing, it's not a black and white. There is a continuum of that risk.
And just to add one more thing to that, something that I noticed as I was digging into the patients is how significantly ill they are. There are so many just very, very sick patients in the hospital right now. And I don't know, was any of that a delay in coming to see their primary care team or their consulted teams? But whenever we're having to shut down some of our ambulatory and shut down some of our elective cases, that again just further adds to the situation that we're in with increasingly ill patients in the hospital, and in some cases, difficulty for people to access their healthcare team.
I just to add on that, I think that's a really good point. Not only are hospitals full and struggling with some staffing issues, they are full of, as a whole, the hospital being the sickest that we've ever seen. Mm-hmm. We have different ways we measure that, but you have to be really sick to get in a hospital now. Mm-hmm. And so they really are full of the sickest patients we've seen, I think, in my career in medicine.
I think Dr. Lewis Satterwhite made a comment about that earlier in the week, that to get into the ICU, you have to be incredibly ill. And that's what I was noticing with our ICU patients, the ventilated patients. They are, and as you mentioned, we've seen the highest case mix index than we've ever seen in our organization, which is one of the metrics we use to evaluate kind of that severity of illness.
On that note, Brian says it's always so helpful when Amanda Cackler comes onto the show. I'm glad that she's still part of the endeavor to educate us all.
You're so welcome.
You are so loved. Okay, so Deb has a question, and someone else asked the question is, so if I'm not boosted, I'm going to get it? So Deb was asking any extra precautions that those can take who have not yet been boosted. And is that true, if you haven't been boosted, that you just are going to get it?
Again, I think the numbers that I see in the hospital, it is, when I'm referring to who is vaccinated, is those who have received 2 doses of the mRNA vaccine and they've been boosted. And the volume of those are the really small count. So I think we had 22 vaccinated today. We have 129 in the hospital. So I think that's one of the very best things you can do to keep yourself out of the hospital, which was the intention all along of the vaccine. It wasn't to prevent the transmission of disease. It was to keep you out of the hospital because of severe illness or death. And I think that's something that we continue to try to speak to, is the importance of the vaccination to keep you out of the hospital. So again, I think those are extremely important. And then what Dr. Hawkinson mentioned too, in addition to those things, avoiding large crowds. Assume that there is COVID anywhere. When you're in a group outside of your household, there is probably someone around you who has COVID. And so you can avoid that by masking, socially distancing, just really being aware of your surroundings.
Yeah, I was actually just going to go, as probably you were too, but very similar place to where Amanda did. It is, to be clear, you can get COVID if you've been vaccinated and boosted. But the chances are less, and the chance of it being a much milder disease is much greater. And so to really maximize the chance of staying out of the hospital, getting sick, getting deathly ill, and or dying, is to be fully vaccinated and get your booster. So would encourage anyone who, for whatever reason, hasn't gotten their second dose, and we know this, that happens, or for whatever reason you haven't got your booster yet. Sometimes it's just a matter of convenience, or I just haven't got around to it. But man, this is the time, I would say.
Yeah, I would completely agree. Again, it's like a seatbelt. A seatbelt won't prevent you from getting into a car wreck. It will help and prevent those or reduce that risk of those severe injuries. So we should note that. I think that is very important to note, that it won't protect you necessarily from getting it. In circumstances it can, maybe in the first 1, 2 to 3 months after that boost, maybe you have a reduced reduction, but that is a very transient thing. Overall, the vaccines were created and continue to do a very good job of reducing your risk of going to the hospital. And I think you as an individual need to understand and take those risks and judge what your risk is. I think if you are fully vaccinated and you have that third dose or that booster dose, I think you can consider going out and doing things and being in public, maybe getting back to some sort of actions that were similar to what you did in 2019. But I think you have to take that and judge that risk on your own. And especially now, if you know there is a high prevalence of disease, maybe just wait a couple weeks to be able to do some of those things you were doing before. As we can get to lower case counts, maybe decreased community prevalence, that would be a smart thing as well.
All right, I've got a headline for you today. Massachusetts becomes the first U.S. state to enlist COVID sniffing dogs. Who wants to grab on that one?
I'm going to, because I'm going to throw in the little bit I know, because I don't know about COVID sniffing dogs, but I know that there is the concept of that for other infections, and I know some organizations have actually employed the dogs to help with C. diff, but I have not heard of that. I don't know if it's technology.
And what is C. diff, Amanda, for our viewers?
Clostridium difficile. It's another organism.
And what is that?
What kind of disease is it?
Now
called,
you
I
can-
guess?
It's
Used as
another infectious disease that we deal with often in the healthcare setting and also in the community. A lot of times it's elicited by utilization of antimicrobials or antibiotics. It causes diarrhea.
Massive diarrhea. Volume is 20 times a day, so it
Thanks,
is not
Dana.
good. So I think that is one more important point about not necessarily infection prevention, but antimicrobial stewardship. Just understand that whenever you get antibiotics, you have that risk of getting this infection. So that's why it is very important for whoever is prescribing to really ask and understand, do you really need antibiotics, particularly for things like upper respiratory infections, which 80% or more are viral, and most people will not need any antibiotics, such as Augmentin or azithromycin, what have you. So I think that is important. I have heard of other places using those dogs to sniff that. I think that the sensitivity of those dogs is somewhat pretty good, but I do believe it takes a long time to train them, and so there are some practical blocks there and practical holdups to being able to employ that. But I don't know the full data set, but some people, we know they're used in other countries as well.
All right, well, it's a 3-day weekend. You got a lot of reading to do on that one.
I'll let Amanda read
Put that on the list.
Thanks.
Okay.
I have other reading.
Jennifer is curious, if someone in the home tests positive, shouldn't we all quarantine? Run us through that a little bit more. Now that everyone's testing at home, what are the rules?
So I think the most recent information that I've seen on this is that you don't it depends again on your vaccination status. If you're fully vaccinated, you've been boosted, I think really if you've had that 2 doses of vaccine and you remain asymptomatic, testing may or may not be necessary. You don't need to quarantine. However, if you develop any symptoms, the testing is important. And at that point, I've always gotten under the assumption if you're going to test, you should sort of treat yourself as if you're positive, just to err on the side of caution and to prevent any kind of transmission.
And the only thing I would add to that is if you have someone positive in the home and you develop symptoms and your initial test is negative, particularly a home test, that doesn't mean everything's free and clear. I think if you continue to have symptoms, would test again, because we've seen sometimes people have delayed positivity on their test.
I think we always need to go over this. We've been doing this for 2 years, but people forget. So good reminder. Melody is curious. Dr. Hawkinson, could you please help me with this issue? Is there a, quote, prescription that all doctors can give to have people do at home to get through COVID? I'm a pediatrician, and I hear local community members that wonder why doctors are not telling people how to just survive this at home.
You know, I think there should be maybe within their practice just a printout sheet. I think that would be very easy. I think that's a great idea. You know, those things that we can do, and maybe there are general, depending on what practice you go to, maybe there are general printout forms of things you can do. Again, for most people, for respiratory viruses, including SARS-CoV-2, they will not need to seek medical attention. So it's important to continue to do those several things. Get adequate rest. Get adequate hydration and nutrition. Take Tylenol or ibuprofen if you can take those to help reduce some of the symptoms such as fevers and aches. Those are all things to do. I think that's a good idea, and I would hope a lot of practices, especially primary care practices, would have those sheets for people to be able to do.
All right, great conversation today and great guests. We're going to get to our final thoughts because we've got a lot of them. Amanda, I'm going to start with you. What do you want us to know as we head into this long weekend?
Sure. So I was in the vaccine clinic yesterday. I think my takeaway, and it's probably been pretty consistent since December of 2020, if you have time to get a vaccine, call and get one. If you are already have received 2 doses and you're ready for your booster, we've got booster available. Come and get it.
All right, Dr. Williamson.
Yeah, so I think something that's really hard to all of us to wrap our brains around is that what we do now is going to impact our ability to take care of patients 3 to 4 weeks from now. And so we see that the healthcare system is strained, and the behaviors that we as a community do right now, this weekend, really are going to impact our ability to get any sort of medical care a few weeks from now. So please, to Amanda's point, get vaccinated if you haven't. Please limit, the gatherings that you're in. Wear your masks, because once we get to that point, we can't walk it back.
Thank you both for sitting here with me today.
Yeah, of course.
Thanks for having us.
All right, Dr. Schmidtke, you're up next.
Yeah, thank you. I have 2 final thoughts. First of all, a colleague of mine has a risk assessment planning tool from Georgia Tech. If you just Google COVID-19 risk assessment, it'll pop right up. And I just checked it for the Kansas City area. If you have a gathering of 25 people, there is a 90% or higher chance that at least one of those people is positive. So I want you to go into this weekend with eyes wide open about the risk that it exists there. In a way, we can say that COVID doesn't affect us, but that's about as effective as shouting at a Category 5 hurricane. This thing is on us. We have to take action. The other thing that I would just say is this is a good time to upgrade your mask. If you're wearing a cloth mask, they're very cute, but they are not very effective against this variant. And so what I recommend, because Amazon is fantastic at being convenient, but has a lot of counterfeit masks on it. What I would recommend is going to a website like projectn95.org. They vet the N95, KN95s, KF94 masks so that you can trust that what you're buying is legit. You can also go to the hardware store, and in the paint aisle, you will find 3M makes a product that's an N95 mask that's very good. So they are more accessible than you think, but I would encourage you to upgrade your mask.
Dr. Schmidtke, always great to have you. Thanks for your insight. Bill Teal, we wish restaurants a successful and safe kickoff to Restaurant Week. Thank you so much for being with us. What do you want us all to know?
Well, of course, we're all looking forward to Restaurant Week, but I would say, kind of brought up before, if you don't feel well, if you've got symptoms, don't come dine in. We want to protect our employees. We want to protect our other customers. So take advantage of delivery and carry out if possible. But hopefully we have a good Restaurant Week, and we look forward to better times in shortly.
Bill, thank you so much for being with us today. Dr. Hawkinson, final thoughts from you.
Yeah, be safe. It is down to your individual health, your individual bubble, and those friends and family. Understand those things that you are going to be doing in those situations that you're in, I think is extremely important. Continue to endorse vaccination, full vaccination, and then booster. Again, there's no wrong time to do the right thing. If you haven't been vaccinated, or people who haven't been vaccinated or gone for their second dose or meet criteria to get that additional dose, please encourage them to go do that. That will only help to reduce their chance of severe illness, and we know that's extremely important. Be safe this weekend and understand all of those situations that you'll be in. And if you have to kind of hold back and wait for a couple weeks, the Chiefs are going to be in the Super Bowl, so we have a few more weeks to be able to do that. Hopefully the case counts will go down within that time as well. But also, the pillars of infection prevention continue to persist, and that is social distancing, being outdoors in well-ventilated areas, hand hygiene, and of course masking. And any mask is better than nothing. Certainly understand the dynamics of that and the fit and all of that stuff. So even if you just have those cloth masks, it's very important. But if you feel that you need to certainly go to those surgical or N95 masks, that's reasonable as well. But again, any mask is better than nothing as well.
All right, good message. Dr. Hawkinson, thank you. And thank you all for being with us on this Friday. Don't forget, you can watch our show anytime logging onto Facebook and our YouTube channel. We have no show on Monday as the nation honors Dr. Martin Luther King Jr. and his legacy. Remember, it's not a day off, it is a day on. His day is also a day of national service. So get out there, serve others, and honor Dr. King's legacy. Coming up Tuesday, Western Kansas, one of the hardest hit areas with COVID. There is a lack of resources, people unable to get to larger hospitals for help. We're going to take a look at the impact COVID is having in rural communities. Plus, one woman shares her story. She lost her husband to COVID. She has a message for you, what she says everyone should know. That's coming up Tuesday at 8. Everyone, have a great weekend. Go Chiefs, and we will see you then.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.